Hey, it's Dr. Centeno, and today I'd like to talk about rehabbing from craniocervical instability, or CCI. Kind of a hot topic. It's a question I always get asked, after we do our procedures to try to help stabilize things. What's the next step? How do I rehab? How do I get my strength back, my stability back, etc.? So I'm out for 6 weeks, but I've prepared 5 lectures on CCI topics that'll be on YouTube and Facebook Live on Fridays at 1 p.m. MST, 3 p.m. EST. There won't really be a Q&A session with me, but I did want to get content out so that everyone can continue to get some of their questions answered about some of these important topics. So craniocervical instability. Instability means not stable, and there's two things that control stability in the spine. One is ligaments, and that's what we can work on with orthobiologic treatments, things like the PICL procedure. The other is muscles. You've also got to have muscles to provide active stabilization, and rehab really focuses on that second piece of the puzzle. So ligaments can be fixed with injections, but unless the muscles come back online to stabilize, there really can be no full recovery from CCI. So it's critical to realize that you've got to get these muscles back on track somehow. And so I've created this 5-stage rehab plan here that starts out with no rehab, and that's really a lot of our patients. They've tried active rehab, it just makes them worse. So obviously in those patients, we're treating various things that are causing pain, painful facet joints, irritated nerves, stabilizing the ligaments, etc. Now at some point, hopefully they get to stage 2 where they can try the online eye-head exercises, head movement exercises that we have. And then once they graduate from that, they can go to specialized physical therapy. And then some of our patients have been doing things like gyrostim, which can be pretty challenging, and then finally cleared for all activities. So note the driving force in advancing this program isn't really the time since the procedure, but the ability to do certain activities and the symptomatic response to those activities. So stage 1, really, this is where we're treating someone who can't tolerate active physical therapy. And they are a mess, right? They try any type of active physical therapy, things will get worse. And so what are the things we want to focus on in this particular stage? Really, the first thing is getting appropriate injection therapy to stabilize the area so you can get to the next stage. And slow range of motion at home just to preserve range of motion. So that means, slow, dedicated movements to make sure that you can still move your neck. In this phase, I tend to see a lot of patients who get into a collar and stay into a collar and don't move their neck at all, which really then creates another set of problems. They've got no range of motion, and we then have to fix the range of motion problem at some later date. So this is really not appropriate because it just creates more problems. In this stage, you can also start working on just basic posture, right? I'm sitting in a chair. I've got a lumbar support that I put into this chair because I know that tends to open up my chest and bring my head back, which is the way I should be sitting. Now, maybe you can't tolerate that proper posture yet, but these are the kind of things that you can explore in this phase. So looking at overall posture, trying to do slow range of motion, and then obviously getting treated. Now we really go to stage 2, and that's someone who's doing better. Their symptoms are down. They're no longer constantly in that fight or flight mode. And we're getting into some low-level strengthening and simple postural work. So during this phase, you're kind of threading the needle. You're threading the needle between getting some activity and starting to get the muscles to turn back on with things like the laser exercises that we have online. And at the same time, you're trying not to provoke your symptoms too badly. So maybe you go through and the laser exercises that we have online, just to describe those for you. You put a little laser on the top of your head. You're following various charts on the wall, or clock diagrams, etc. And the goal is to get you to start to move your neck, focusing on these suboccipital muscles and getting those suboccipital muscles back online. Now, for some people, that's going to provoke symptoms, so then back off. But you want to thread that needle between provoking symptoms and getting those muscles to turn back on. Here you can also integrate some simple postural work if you weren't able to do it in stage 1. That is, again, working on a program to get your head over your thorax and have a curve in your back, and where your shoulders are not like this, but like this. And that takes the weight off of the head. So again, here we're continuing injections in most of our patients, some not. And they're threading the needle with activity, using the laser exercises, trying to get through the whole set that we have online. And they're doing some simple postural work. Now, stage 3 is when you've gotten past those eye exercises that we have online. And the focus of this stage in recovery is to begin to increase normal activities and add strength. So you've gotten through the eye exercises. You can do that without provoking symptoms too badly. So this would be a good time for us to do a physical therapy referral. I tend to like IPA physical therapy, very advanced physical therapists around the country, and you can get that IPA referral from us. You can also do possible curve restoration. So I always tell patients to roll up a towel and put it behind their neck here. And you can experiment with the thickness of the towel, but if you can lie on a flat surface and get that curve back in the back of your neck, and that feels good, then you're ready to start curve restoration, because a lot of our CCI patients lose their normal curve. And then you're starting to add back some normal activities that don't really aggravate symptoms. So again, here you're threading the needle as well. You're doing some activities, and maybe you get to one that provokes symptoms, so you don't do that one, and maybe you try that in a couple weeks and see if you can tolerate it in a couple weeks. But you're always pushing towards trying to increase activity here, with obviously the help of experts in curve restoration or active physical therapy. And then stage 4, this is where you've graduated from physical therapy. You're not really having that many symptoms, but you're trying to get stronger. And a lot of our patients have done gyrostim in this category. So that means that this is a specialized machine where you sort of hold a laser pointer and point at targets while they move you from left to right or rock you back and forth. Now, you want to start slowly here. The goal is to give challenges to your neck proprioception and strength, as you have to focus on a target with your hand, so eye-hand coordination as well. So coordinating eye-hand coordination with what's going on with the input from your neck and strengthen your neck. And then obviously gyrostim, you're in a chair and you get turned upside down, sideways, etc. Can be much more challenging. But again, during this time, you're adding back your normal activities, trying to, again, stay with the principle of threading that needle and not doing activities that really increase symptoms, but challenging yourself every once in a while and maybe increasing your symptoms just a little bit. And then seeing if you can just do a little bit more the next week or the week after that. And then finally, stage 5 would be cleared for all activities. And that is adding back even high demand activities like running, weightlifting, etc. Again, some people may find even in this stage that they have to eliminate or not do certain things that they like to do before, but at least they've made lots of progress and they're doing most of what they want to do. Now, we've had patients return to jujitsu, for example, pretty high demand activity with grappling. We've had patients return to running. We've had patients return to skiing, et cetera, et cetera. Now, for some of those people, they don't have any symptoms. Some of them maybe still have some symptoms, so they avoid some things, but they're doing most of what they want to do. So, in summary, rehabbing back from CCI is certainly possible. We see it done all the time, but it often requires threading the needle between protecting the weak areas and causing symptoms and allowing enough activity to strengthen muscles. And this rehab game plan is what I follow with my patients. So it's possible, but again, you have to become an expert at identifying what's too much for you and then backing it off just a little bit from that and then trying it again in a couple weeks to see if you can tolerate just a little bit more activity. So thanks so much for watching. I'll be back soon from my timeout, and we'll be doing live Facebook Q&As and YouTube Q&As, but for now, hopefully this helps. Thank you so much, and have a wonderful day.